Hello and welcome to the Health Dialogue Show. I'm Yakshi, and today we're addressing a topic that's close to the hearts of many parents. What to do when your child isn't learning to speak as expected. Speech and language development is a key part of a child's early growth, but delays are more common than many people can realize. The good news is, with the right information and timely intervention, children can make remarkable progress. To help us understand the science, causes, and solutions around speech delay in children, we are joined by Dr. Himani Narula Khanna, Developmental, Behavioral Pediatrician, and Adolescent mental health expert, co-founder Continua Kids. With years of experience, Dr. Himani Narula Khanna will guide us through what parents should know and do if their child isn't speaking on time. Welcome, ma'am. We are privileged to have you with us today.
Thank you so much. It's my honor to be here and be able to answer some of your queries. Thank you so much.
Yes, ma'am. So, ma'am, my first question to you is, what are the common signs that a child may be experiencing a speech delay? And how can parents differentiate between normal variations and a cause for concern?
Yeah. So, as a developmental pediatrician, I would often emphasize that parents of every child should know that their child develops at its own pace. But if certain milestones are not achieved at a designated time, then it's a red flag. So in speech development, we need to look at certain milestones, like if at 12 months of age, the child is not initiated pointing, not waving, or is not using gestures, or is not saying syllables like ma, da, ba, mama, papa, dada, or if at 18 months the child is not using at least 4 to 5 meaningful words, at 2 years, if the child is not having a vocabulary of at least 50 to 100 meaningful words, or is not joining two words together to make short phrases like mama, ow, do, like that, or if at 3 years the child is having very limited vocabulary, is not able to make phrases, or is not able to express and communicate using words, then it is speech delay. So these certain milestones the parents need to keep in mind. However, it's important that every child is different, and if there is a consistent regression in speech at any time that the parents have noticed, or the child is not responding, or is not pointing, is not interacting with us, is not responding to name call, then that calls for more developmental concerns, and that the child needs a proper thorough developmental assessment.
Great, ma'am. So, at what age should parents seek professional help if their child isn't speaking as expected? And why is early intervention so crucial in these cases?
Yeah. So, see, what happens is when the child is young, mostly they start speaking monosyllables, bisyllables between 12 months to 18 months. So if at 18 months, a routine screening can be done for each and every child, and if a child is not speaking 4 to 5 meaningful words, or is not using index finger to point and indicate their needs, or is not following a direction where we as adults are pointing and showing the child, look, there's a fan, there's a bird, and the child is not looking in that direction. So those kinds of red flags, if we observe in a child, that calls for attention. And we can do a thorough screening at 18 months for each and every child and identify the red flags. And if we identify any risk factor, or the child is found to have those red flag signs, then early intervention should be started there itself, at that age itself. We shouldn't wait for the child to turn 2 or 3 or 4 years of age to start intervention. Why? Because early intervention, early years of life are very crucial for brain development. What is happening is the brain neural pathways are very rapidly developing. They are forming connections, and timely therapy can make a significant difference in their long-term developmental outcomes. So it's very important that we don't delay the interventions, because early intervention will reduce our total duration of intervention, will have faster and better long-term developmental outcomes, and the child will learn those skills much early on, because the brain is still forming those connections. So early intervention is definitely the key.
And ma'am, what are the most common causes of delayed speech in children? Like, how can these be diagnosed accurately?
Yeah, so speech, when we talk of speech, the first thing that comes to our head mind is that, okay, can my child hear? If my child cannot hear, the child will not learn to speak. So we must make sure that the hearing is all right and there is no hearing impairment. So check for the hearing impairment. Then we must look for oral motor. How is the tongue? How is the oral motor system? Does the child use tongue appropriately? Is opening, closing the mouth properly? So oromotor system examination is typically done to see if there are any challenges there. Then we must also have neurodevelopmental disorders in our mind, because they also have speech and language delay, like autism spectrum disorder, social communication disorder, intellectual delay, or global developmental delay, where the child has cognitive delay as well. So those children do experience speech and language delay. Then there could be purely environmental deprivation, where the child has not been adequately stimulated in their early years, and as a result the child has not learned any vocalization or is not learned language. Then lastly, there could be some neurological conditions where the child has not cried at birth, like cerebral palsy, or there could be some genetic disorder or some syndromes where there can be speech and language delays. So there are multiple causes. We should be able to evaluate and rule out various causes and come to a diagnosis, and then plan our course of intervention.
Okay, ma'am. So, ma'am, in this, what role do family interaction, screen time, and bilingual environments play in speech development?
Yeah, so see, family is the first area where the child gets exposed to, or first set of people or humans that the child is getting exposed to after they're born. So that is the foundation, and that is the foundation of speech development. So whatever the family members are talking, the words, vocabulary, language, that immediately the child is listening from the environment in the family, or is mimicking them, or is engaging with a parent or a grandparent or any caregiver. That is the language or the words that the child is hearing. That is the foundational speech development which will happen for the child. So simple activities parents can do, like reading aloud or singing to the child, responding to child's simple gestures, or when they're babbling, we should reciprocate and respond. Instead of ignoring, we can respond to the child's babbling, and the child will have a full conversation in their babbling tone also with us. So that kind of a reciprocation helps to nurture the language skills in babies. Then coming to screen time, yes, screen time does have a role in causing speech delays, I would say. So we should be very, very clear that we do not expose the child to any kind of a screen time till 2 years of age, because it has been seen in research also, in various publications and research which are published in renowned journals. They've said that exposing the child to screen can lead to speech delay as well as impairment in their attention span. So it's very important that there should be no screen time for the child of any kind, be TV, mobile, iPad, desktop. Any kind of screen time should not replace a human interaction in age group from 0 to 2 years. Post that also, from 2 to 6 years, it should be less than an hour, and that too under supervision of the parent. And when it comes to bilingual, yes, parents do have a lot of concern around bilingual environments, that, oh doctor, I am a Bengali and my husband speaks Hindi, so how do we tackle that? Or we speak two languages, we are from different cultural sites. So that's okay. Bilingualism does not typically lead to speech delay in developing children. In fact, it stimulates their cognitive learnings. It has cognitive benefits. But in some cases, we have seen that bilingual child may have mixed language. They will use both the languages to communicate. They will have a mixed set of vocabulary to express, but it does not typically lead to speech and language delays. So there, they should worry less when it comes to multiple languages being exposed to.
Okay, ma'am. So once a delay is identified, what kinds of therapies or interventions are typically recommended?
Yeah. So once we identify that the child has speech and language delay, which is like 80% of the time the parents reach out to us with speech and language delay, but when we do a thorough assessment, we do come out with various diagnoses. It is whether it's hearing impairment or autism or social delay or communication disorder. So according to whatever is the diagnosis, the interventions are planned, because sometimes it is just the developmental speech delay where the child understands, comprehends, does all kinds of pointing and gestural communication to indicate their needs, but the child is not able to verbally express. So there, a speech language based intervention will be helpful. But where the child has a communication delay, the child is not socially interacting, not listening to the name call, not responding to instructions, not engaging socially with us, there the child does need other interventions like occupational therapy. They may have, children at times have sensory processing issues, so they may need support of behavior therapy to help them with behavioral intervention, speech language pathologists, special educators. These are some of the team members of a multidisciplinary team who can help the child learn various set of skills and help them achieve their milestones on time. So, and not to forget, parent is always a co-therapist. So parent training programs to be run simultaneously is a must, because we need to teach the parent also how they can work and what they can do with the child at home and help the child catch up on those milestones.
Thank you so much, ma'am. That's all. Thank you so much for taking your time out for us. Thank you.
Thank you. Thank you so much.